Hi, I'm Dr. Simone Peters, clinical psychophysiologist and IBS expert. Today I'm here to answer your questions around irritable bowel syndrome. What is irritable bowel syndrome? Irritable bowel syndrome is considered the most common disorder of gut-brain interaction. It affects about 11% of the population and is characterised largely by abdominal pain and issues that relate to bowel function. And typically this includes things like diarrhea, constipation, or a little bit of both. What's really happening to the body during an IBS flare-up? There's lots of things happening to the body during an IBS flare-up, and most of them are physiological in terms of the response. So most people during an IBS flare-up will get symptoms of abdominal pain, they might feel bloated and distended, they might have issues with diarrhea or constipation or a little bit of both. And so you can see here that that means that there's been alterations in their motility, so things are moving through too quickly or things are moving through too slowly. And obviously, given that pain is a driving factor, all of these nerves that are in their tummy are just much more active for that period of time. How does gut-directed hypnotherapy work? So the premise behind gut-directed hypnotherapy is that we want to make direct suggestion to what we call the subconscious part of the mind. So during a state of hypnosis, we want to make that person feel really comfortable and relaxed because we know that the subconscious part of the mind is much more receptive to suggestions that are given in that state. And in people who have irritable bowel syndrome, those suggestions are around the normalization of gut function. Hi, Dr. Peters. I have IBS. What are the advantages of gut-directed hypnotherapy over other solutions? I think the first point to note is that it's not necessarily one size fits all. But there are some really notable advantages to gut-directed hypnotherapy. One of these is that there are relatively no side effects associated with doing gut-directed hypnotherapy. We know that the vast majority of people who do hypnotherapy respond beautifully. So we see about a 75-80% response rate, which is really high compared to rates of other therapeutics, which can often be offered to patients who have irritable bowel syndrome. We know that there's no impact to nutritional adequacy, and so we can be really confident and reassured that people don't necessarily need to change their diets. We also know that delivering it digitally, so with apps like Nerva, that we can make it more accessible to people and we can make it more cost effective. Why does a low-FODMAP diet work, and will gut-directed hypnotherapy work better? A low-FODMAP diet is a really effective way of managing symptoms of irritable bowel syndrome, and it works by reducing these dietary triggers in terms of them aggravating the gut from a visceral hypersensitivity and motility perspective. We know that gut-directed hypnotherapy works very similarly in terms of targeting these same mechanisms. So it's not necessarily that one will work better than another, but it might be that you as an individual respond better to one over another. I've heard my IBS isn't caused by the foods I eat. What's the cause then? This is a really tricky question to answer. What causes symptoms in one person with irritable bowel syndrome may or may not cause symptoms in somebody else. I think ultimately the question is not what causes my symptoms, but what management strategies we have in place and what person is going to respond best to each strategy. I've had IBS for 10 years and I've lost hope. Will gut-directed hypnotherapy work for me? Firstly, I'm really sad to read this, but unfortunately it is not uncommon. A lot of people who have irritable bowel syndrome feel as though they haven't been able to manage their symptoms effectively, and this can be for a number of months or even years. I guess in relation to whether gut-directed hypnotherapy will work for you, we know that the evidence of efficacy is really high. So we know that 80% of people respond favourably to hypnotherapy, and of those people who respond, we see about a 70-75% reduction in their symptoms. So what I can tell you is that the stats are most definitely in your favour. I think the other really important thing to consider is that most people with irritable bowel syndrome respond really well to a multidisciplinary approach. And so maybe you've found relief from some of the things that you've tried thus far, but you haven't got to a point where you feel like your symptoms are really well controlled. And so it might be that the gut-directed hypnotherapy is just the missing piece to the puzzle that you need. If I know food triggers my IBS, How would gut-directed hypnotherapy help? We know that food triggers IBS in a lot of people who have issues. In saying that, the mechanisms behind the alteration of your diet and the utilisation of behavioural-based strategies like gut-directed hypnotherapy are working on these same core mechanisms of issues around visceral hypersensitivity and altered motility. So the idea is that we can use behavioural-based strategies like hypnotherapy to alter these mechanisms so that hopefully in the long term people don't need to restrict their diets as perhaps what they might have had to in the past. My doctor recommended gut-directed hypnotherapy. I'm sceptical. Help. Okay, so I think I was the biggest skeptic of them all when I first started working in this space, believe it or not. But I think that what has convinced me over the years, and what I hope will convince you, is that there's been so much research that has been done into this space now, so we can feel really confident that it's doing exactly what we want it to do. Like I mentioned before, the statistics are high, so we know about 75 to 80% of people respond to hypnotherapy, and we see about a 70-75% improvement in their symptoms. Does that mean that you will fall into that 75-80%? I can't answer that question for you, but the stats are definitely in your favour. Thanks for watching. If you're interested to find out more about gut-directed hypnotherapy and Nerva, please click the link below and take the IBS quiz.